you are confronted with results and you think, I thought I did a very nice job, but it doesn't look as great anymore. And that makes you rethink about the first initial surgery and trying to adapt that to achieve better results in the end.
But not to interrupt you either, but when you have that follow-up too, it's hard because in that time frame, techniques can evolve.
Definitely, yes. Yeah. That's why you should.
Welcome to the Deep End. Today, we're joined by Dr. Irene Mathijssen, Professor of Plastic and Reconstructive Surgery at Erasmus MC in Rotterdam, head of the Craniofacial Unit, and this year's Linton Whitaker Visiting Professor. Dr. Mathijssen's path is a remarkable one, from an early dream of studying gorillas in the wild to finding her true calling in craniofacial surgery. She has since become a global leader in the field, spearheading the European Reference Network, leading long-term outcome studies in congenital anomalies, and preparing to serve as the president of the International Society of Craniofacial Surgeons. In this episode, we dive into her career journey, her vision for team-based, centralized care, and her bold research that challenges assumptions about when surgery is and isn't the right choice for children and families. Let's dive in. Dr. Mathijssen, thank you so much for joining us. It's such an honor all the way from the Netherlands coming to visit us.
And you came with beautiful weather, so thank you.
And as our listeners know, Dr. Whitaker was one of our guests, one of our initial guests. We've had Dr. Taylor.
Was he our first?
He was our second.
Second guest.
We've had Dr. Taylor on. We've had Dr. Liao. And I know you were just visiting Pittsburgh. We had Dr. Losi on, Dr. Rubin.
Yeah.
So we're really excited to have you here. And your morning lecture was very inspiring. We'll get into that as well. So even if you're, just like you said at the beginning of your talk, even if you're not someone who's pursuing craniofacial, I think it was something everyone can get out of because it was a very, well, we'll get into it. I don't want to ruin the surprise and we'll let you.
But it's also important too because the whole basis of this podcast is the Center for Human Appearance, which was Linton Whitaker's vision in the past, really combining a bunch of disciplines focused on human appearance. So dermatology, facial plastic surgery, oculoplastic surgery, etc. So you're the perfect guest for that.
Good.
Have you ever been on a podcast before?
No.
We saw your TED Talk from...
Exactly. The TED Talk was there, but that's a long time ago by now. And I had a podcast done for the Seattle meeting of the International Society with Ben Mussenberg from here.
Of course.
We did that as a little intro for the meeting that we had in Seattle in 23.
That's awesome. And of course, we'll give a plug that you're the president of the International Society of Craniofacial Surgeons.
Thanks.
That's amazing.
And when you said, I remember September 7th to the 10th in 2027, it will be back home for you.
Yes. It will be really special to host that meeting in Rotterdam.
Oh, wow.
Yes.
Yeah.
One of the things that we're always interested about when speaking with people like you is how did you get to where you are today? Like when you were a young kid going to school, did you one day just say, I want to do medicine, I want to be a plastic surgeon, I want to take care of pediatric patients in the future? Like what kind of shaped you into who you are today?
Yeah. Well, actually, I didn't have an interest in medicine at all. I was fascinated by Diane Fossey. I don't know if it rings any bell. She was a researcher based in Africa, and she was amongst gorillas, the really big one, the silverbacks.
Wow.
She lived with those, and she just had a notebook, but then literally a notebook, like paper and a pen, and observed what these gorillas did for research purposes. And I thought, this is the true life that I would like to live. So I really aimed for going into veterinarian school. But then in the end, I had to choose when I was 18, would I go for medicine school or for veterinarian? And I thought, well, how likely is it that I end up with silverback gorillas or end up treating rabbits and cows and pigs? And I thought, no, I don't want to go for that. And then I decided to go for medicine, thinking that I would never do any surgical part because I thought that's pretty scary. I don't think I'm up to doing that. But then you grow on that. So slowly you get used to it. And I thought, this is fabulous. And during college, I got more exposed to surgery, but in plastic surgery especially. And seeing for the very first time a craniofacial case, I still remember, and I thought, this is the coolest. This is what I like it. That was Michael Vaandrager. And that was someone that was in the first generation of craniofacial surgeons. So together with Jacques van der Meulen, also same age like Dr. Whittaker, so that generation. Incredible. And that's why at the initial stages that craniofacial surgery was started, it was brought to Rotterdam. So thanks to them.
Yeah, that's really cool.
Yeah.
With regards to like your family influence or your friends, were anyone else also in medicine that you like looked up to, or who were your other mentors at the time?
Well, actually, I didn't have mentors in that sense. So both my parents were teachers, so completely different.
But helpful for what you do.
Potentially, yeah, potentially. So giving educations, I like that, and maybe that's what I got from them. But there's no medical history within my family that pushed me that direction.
Yeah.
So, and it just slowly progressed on me. And I think that, the one I mentioned, Michiel Vaandrager, has been of a big influence because he was such a skilled surgeon.
Yeah.
But never published. And I thought, it's such a waste. All the knowledge, he's going to retire. He's done fabulous things. And he said he was unable to write scientific papers, so he tried but didn't succeed. And I thought, this is a shame. And that's actually when I started as a medical student still. I thought, I need to collect all the data that there is of his patients.
Yeah.
Because that's going to be so interesting. And I think that's the basis of where I am now.
Yeah. Well, you know what's nice is that I think back to being a medical student or a resident, and you work with such giants. Yeah. And at that point, you can use their data for good studies. Yeah. And then all of a sudden, you become a junior attending and you don't have your own data. And that luxury isn't around anymore. Yeah. You know what I mean?
Yeah, exactly. No, that's true. But there's other ways to fix it. So I continued on the database that I created of his patients. Because it takes a lifetime to really evaluate the outcome in congenital disorders.
Yeah, you're so right. Yeah, and it takes a lot of patience. Like you were saying, I mean, you mentioned one of your studies today with the need for 8-year follow-up.
Yeah.
Which I think takes us to like one of the other points, talking about your clinical and your research aspiration. And I don't want to give it away. I want to hear it from you about why the unification of your clinical services in Europe, but also what excites you most about your research. So kind of the clinical side and how you're spearheading that, the organization involved, and why we're having trouble doing that here in the U.S., but also your research aspirations and what excites you the most.
Yes. So not to cut you off, but for our listeners, what we're alluding to who weren't here this morning is the European Reference Network.
Yes.
And what's very unique amongst craniofacial surgery, obviously, is if you're operating on 6-month-old, 8-month-old, you can't see some of the things that we're trying to follow to see whether it was worth it or not may take until 10, 20 years, whereas in a lot of other areas of plastic surgery, you might only need to wait a year or two, and we can kind of analyze what we're doing. So, talk a little bit about that.
Yeah, I will. So what intrigues me in general is like embryogenesis. It's amazing if you know how complicated this process is.
It's extremely complicated. I did not like that subject.
I thought so too. But then you realize it's so complicated and it goes well so often.
I know.
That's intriguing.
It is
but
intriguing.
It's even more intriguing if you see congenital disorders to try and understand, and all of a sudden you get embryology. You understand if some of these processes go wrong, why a patient looks like they do.
I know.
So that was the first intriguing part for me. So to really understand why congenital anomalies exist. And if you understand why it occurs, you can also understand what is needed to correct it. But the other interesting stuff is, of course, how does it affect growth? Because, of course, if you do surgery on an adult, the surgical result will be clear within a year and you'll be satisfied what it is. And then aging kicks in, of course, that can affect your results, but not the way that growth affects your result in children. And that's so intriguing. And if you do follow-up studies long enough, just by doing your clinics and seeing your own patients for a long period, you are confronted with results and you think, I thought I did a very nice job, but it doesn't look as great anymore. And that makes you really think about the first initial surgery and trying to adapt that to achieve better results in the end.
But not to interrupt you either, but when you have that follow-up too, it's hard because in that time frame, techniques can evolve.
Definitely, yes.
Yeah.
That's why you should not change every single minute. There's sometimes a tendency that everyone thinks, no, but I've got the solution. I'm changing the technique. Now I know how to do it. Yeah. I think you should allow some period of evaluation to be sure what's the effect of your surgery.
And that's why this network is so important, because we're gathering a lot of data at once.
And the nice thing is you have multi-center studies, so you can compare. Everyone does something a bit different for the same condition. And if you compare outcome of these treatments, you can actually see which one has the best outcome. And then go back to that surgeon and ask him, what is your protocol and what are you doing to achieve such good results?
Yeah.
And you will never be able to do that on your own with your own personal protocol.
Yeah. One of the things that was most surprising for me this morning was to hear a craniofacial surgeon go up there and say, maybe we shouldn't be doing this operation. Maybe we shouldn't be operating, which I can imagine is super controversial.
Yes.
Can you talk a little bit about your prospective study on trigonocephaly?
Yeah, definitely. So in general, because I think that's important also to emphasize, most of all these craniofacial conditions need surgery.
Yeah.
But we should really look at all the individual disorders. And I think that trick is really a separate disorder that is not so commonly affected by raised intracranial pressure or other issues that really require surgery. So I was struck by the fact that these children have a high level of ophthalmic issues like hypermetropia, so visual disorders, and a high likelihood of having disorders in behavior and intelligence, even if in the ones that got the regular craniofacial surgery. And in the end, when they aged, they didn't look much better than they did when they came into the office. They had the retrusions on the sides of the forehead, a flattened forehead, and I really thought there's something strange. I never seen adult patients still looking like a trichinocephaly patient without surgery. While I did see that in the other cases, like a sagittal or a unicoronal synostosis. So I think this is a clue that there might be a normal tendency to improve in head shape without surgery. And if I'm not solving their behavioral issues, I'm not solving their visual issues, the level of raised pressure in their heads is really low. It's below 2%. And I actually induce a dysmorphology in the end that I need to correct when they're 17 or 18 years of age. What am I doing?
Yeah.
And that was the ground for starting this project, in which I really explain this to parents and say, I think your child could be as well taken care of without the surgery. We'll do exactly the same follow-up. If there's ever an issue, we'll pick up on it very early and still be able to treat your child so he will not be negatively affected as such. But I think we can do it also without surgery.
Yeah. You know, I hear you talk about it. You have such a way of delivering that message that puts me at peace, because I have 3 kids. And I think to myself, maybe times are changing, but I feel like the social ramifications and stigma in school, other kids looking at you with facial dysmorphology, etc. It's very hard. It takes a psychological toll. It can lead to depression. You mentioned a lot of them needing psychological help.
And that ends up being more of the problem than even, a surgical aspect.
Yeah.
Yes.
So and as a parent, I put myself into the parent's shoes, and you don't want that regret. You don't want to look back and say, gosh, I wish I had done this.
Yes.
Should I have done surgery? Should I have not?
Yes.
Yeah.
What do you think about it? It's even me just talking about it gives me a lot of anxiety.
Yeah. No, but that's definitely a topic that I spend a lot of time on. I know that they feel that there's a chance that their child might be bullied because he looks different. All these fears that you have as a parent. And I try to explain to them that, again, from research, we know that being bullied has little to do with how you actually look. It's much more to do with how confident are you about yourself. And that's where parents are vital. So I have patients who look really abnormal, but had fantastic parents saying, this is how you look, we're not ashamed of it, go out there and just explain, this is how you were born, you're different, and that's fine.
Yeah.
And those do so well. Of course, it's not an easy life.
It's not, yeah.
But even children who look completely normal don't have easy lives themselves.
You're right.
They might be bullied for any reason.
Yeah.
If they want to pick on you,
they'll find a way.
They'll find a way.
Yeah.
And that's what I try to explain to the parents. Like, of course, I understand you want to do the best there is for your child, but that doesn't have to be surgery. And there's always the option to go for surgery if you feel bad about it or are in doubt. And so I open up some room for them because, of course, if they're very uncertain about it and I cannot convince them that it's the right choice to go for conservative treatment, I don't disagree with doing the surgery. But I try then to move from a complete remodeling to a more minimal invasive surgery to minimize risks for complications. Because I feel as a surgeon, it's also my responsibility to balance the gains versus the complication risk. And if I feel that actual surgery wasn't necessary, I would accept a minor risk on complications.
Yeah.
That should be balanced.
Yeah, you know, you also brought up the point this morning, and I think about this too. I think us as plastic surgeons, we're kind of in tune with how people look. It's like the first thing we think about. And sometimes I think about perhaps some of these more minor cases, like how much do their friends or does the society actually even see that there's an abnormality, or are they just slightly different? Is there anything to tell us, like, you know, perhaps the parents perceive the child as looking different, but when you put this child amongst their friends, those people actually most oftentimes don't notice a difference?
Yeah. There's really nice studies on that they had pictures graded by several groups, like laymen, doctors, and artists. That's the most interesting. That doctors were the most critical. They pick out any deformity. Lay people are very much less judging on that aspect. They thought a lot of these issues were like normal variations, didn't see anything wrong.
Yeah.
And the artists were the most liberal. They thought even very asymmetric faces were completely acceptable and fine in their perspective. So I think it's good to realize that everyone has a different perspective looking at exactly the same picture.
Yeah, you know what's funny? I'll share this one story, is that I was, as a surgical resident, I was doing a case, a pediatric case, craniofacial case, and the surgeon that morning went to go greet the patient, talk about the surgery, and the patient was accompanied by their parent. And the surgeon at the time noted some dysmorphology with the parent's face and mentioned it to the parent for the first time that morning. But it's something that the parent had never noticed or no one had ever brought up, but we picked that out, you know, and it's, anyways, it's kind of just an interesting story.
And I think I'm always a bit reluctant to point out issues that I see in parents.
Because they might not see it.
Yeah, and they can lead to big issues. Like if there's a genetic component, all of a sudden it could create sort of guilt with the affected parent. Like, oh, but I should have known and I did this to my child. Which is, of course, not true, but it's a sensitive topic.
No, absolutely.
Yeah. That brings me also to just, social norms and everything. I'm sure there's also differences in the Netherlands versus the U.S. What are other, major differences just in healthcare, that you've noticed on your travels from how we treat our patients versus in Europe and around the world? Yeah,
I think especially for these rare conditions of congenital craniofacial anomalies, we have this ERN that you mentioned, the European Reference Network. And that is the goal of those network is to deliver expert care to every patient with a rare condition within Europe, even if it's not available in your country. So that's a really nice goal. And within the network, we only allow true experts, and they are acknowledged by their health department of their nation as being the center of expertise, and we have additional criteria that they have to meet within the network to be a member. So that really allows that we have the experts on board to design what is the best treatment for patients, comparing protocols among the different centers, and move on to improving care.
So in other words, if you have one of these rare disorders, you can't just go to any hospital or surgeon and get that surgery done unless they are recognized as an expert.
In the Netherlands, it would be impossible because we all know that it's only 2 centers that do this type of surgery, and we have guidelines, and that has a legal status in our country that only these 2 centers are allowed to deliver this type of care.
Yeah.
Yes.
What are some of those conditions that make that list?
It's for craniosynostosis. That's the one, but it's also related to cleft surgery, but also very other conditions outside of our field, like cardiac surgery in children, things like that, pediatric oncology. So that's all very centralized to really give the best type of care. And gender surgery is another one. We don't do it. It's in another center in Amsterdam. So we really divided these rare conditions that need special care by a team to get the best care for these patients. And you get, if you centralize all these patients, it increases the numbers of cases, so you can do better research and you can evaluate your outcome and again have the cycle again of evaluation and then improving your care.
Yeah, that's awesome.
In your leadership role at your institution, you're head of the division or head of the department.
Yes.
MD, PhD, MBA, soon to be president of the International Society of Craniofacial Surgeons. So congratulations on that.
Thanks.
What is though, and we know a lot about we can even see it in a lecture without reading about you, a lot about your leadership style, and it resonates, it really energizing even to us on this podcast. So what is something that you hope to take with you as the president of the society in 2027?
Oh, that's an intriguing question. Well, I think the nice thing about that society is that is one of the few societies where all the different specialties come together. So we have neurosurgeons, plastic surgeons, maxillofacial, orthodontists, and various others. And that is rare. And that's exactly as a team should be composed. So you need to interact, you need to understand each other to really collaborate and bring it forward. So that will be actually the topic of the first day of our conference in Rotterdam, to really work on team care. Because sometimes I think the term team is used lightly. If there's 2 of you, you're a team.
Yeah.
But you really need for this kind of complex diseases.
Absolutely.
Someone should understand how the ears work and the hearing and the eyes and vision and their breathing. And there's so many topics that I'm really no expert in.
Yes.
But I can learn from them and they can learn from us.
For sure.
So I think that integrated care is key, and that's what I want to bring to the table in Rotterdam.
And that was the impetus for like this podcast, bringing even more wide specialty of plastic surgery all together to learn from you. The Center for Human Appearance, the same thing. All the different specialties that have something to do with human appearance.
Yeah.
And we all take pride in our hometown. Like I'm from Norfolk, Virginia here, but I'm from Lebanon originally, and I always think to myself, if I have people come with me to visit these places,
where would you go?
I want to show them this.
Yes.
So what are you most excited to show off of your beautiful hometown to all the people who will be visiting?
Okay, Rotterdam.
The food.
Yes. I think a few highlights of Rotterdam. It's a very modern city. The history is not so nice because it was bombed in World War II, but it actually made it possible to erect a complete new and modern city. So there's a lot of architecture that's fabulous.
It's beautiful.
That's nice.
Yes.
It's a very big harbor that we have. And that's also nice because that brings a lot to a city. It brings a lot of culture. We have the highest number of cultural background of the entire country within Rotterdam.
Oh, wow.
And it's related to this harbor. So it's a vibrant city, lots of young people, a lot of going on stuff like festivals, nice food from all places around the world.
So it will come.
Yeah.
That's really exciting. We have a few other questions that we like to ask most of our guests. One of them is like, thinking back to your career, you've accomplished so much, you know, thinking back to your days with the guerrilla aspirations to where you are now, but also like educating, science, clinically busy. Thinking back, is there anything you tell yourself like, I should have done this differently, or I wish somebody had just guided me in this direction first? And I saw you got your MBA. Like, did you get your MBA as part of like your leadership plan?
Yeah, I think if you look at it now, it might appear as if there was a plan, but actually not really. I just really followed every time what interested me most.
Yes.
So I was involved in that very first case I see in craniosynostosis, and I thought, this is really fabulous. I want to pursue this. And I went along and did my PhD on that topic, realizing that if I would even become a plastic surgeon, there was only 3 positions within our center to be involved in craniofacial surgery. But I thought, well, let's give it a try. I love it so much. I'll see what happens. And then I got a position after my training to remain in Erasmus, but not in the pediatric department. But I thought, well, let's see what happens. So I started off doing hand surgery, free flaps for head and neck and lower limb. And I like that too. So that's at that stage, everything is nice and doing that together. But I always kept my eyes out on the pediatric part.
Yeah.
And then someone retired and a position came open, and then I was there.
Yeah.
And I still continue doing my research on that topic, and that's when then you move to a next position. And I think that is something that I tell it my residents often. Don't expect that the very first job you will have after finishing your training will be the most ideal job that you aim for.
Yeah.
Sometimes you just start somewhere in an environment that you really like and you feel comfortable with, and you develop into the surgeon that you want to become.
Yeah, that's so important.
Yeah.
It's hard too, because we talk about this all the time, particularly with craniofacial surgery. With all of our residents who are interested in it, they know that if you're interested in craniofacial surgery, you do a fellowship, it's not certain where you're going to end up. It's not like you can have your pick and say, I'm going to be faculty at CHOP.
No.
You know, that's unrealistic. You know, you may have to go to Milwaukee or Utah or wherever.
Yes.
But if that is your passion, just like you will find a way.
Follow your heart, because doing something you don't like actually that much, it will make your life so uneasy.
Yeah.
I would hate getting up every day doing something I didn't like.
Yeah.
You're so right.
Then you're already looking forward to retirement before you get started. So I think there's always multiple options, and if you really want something, you'll get it in the end. But it's not a free ride that it will be there out waiting for you, the perfect place. You can create it. And I think even within a certain good hospital where you have nice colleagues that you trust, you can develop your own interests within that field.
Yeah. Yeah, no, absolutely. Do you want to ask some of the rapid?
Yeah, so thank you again for your time. This was such a great episode. I think our listeners are going to love it. We have some fun, quick ones we just end with. So we listen to music. A lot of surgeons listen to music in the OR. Is that something that you guys do in Europe?
Definitely.
What kind of music do you listen to?
Well, usually it's just the radio.
Yeah.
And I am very happy if it's like the 80s and the 90s music. Because then I get all excited. And I think, I know these songs. But of course, I adapt, because usually the scrub nurses are way younger than I am. And they have their own preferences. So sometimes I just listen to the modern stuff.
Yeah. Awesome.
And what's your favorite thing to do outside of science, outside of work, outside of all of this?
Yes. Well, I love to go out for dinners.
Yes.
And it could be fancy dinners or simple dinners. I don't mind, but it's nice to have good company and nice food.
Yeah.
And I hate to cook.
Yeah.
So that's a perfect combination. So that's a big favorite of mine. I like to go to the theater for concerts or modern dance. I love that as well.
Wow.
So that's nice. In a city like Rotterdam, you have all these opportunities to go there.
Oh, that sounds amazing.
And I also now enjoy sports. I was not a big fan of sports, but I now go to fitness and Pilates, things like that. And I can tell you, as a surgeon, you need to do it to keep fit. And even if you start doing it, I think everything you start doing, you get better, and then you'll enjoy it. And that worked for me.
Absolutely. Yeah. And then my last question is, do you have a favorite surgical instrument?
I love the Howards. Do you know the Howards device?
The Howards?
The Howards.
I don't know if we know that.
It's like a rasp, but it's especially designed, and I love it. I use it all the time.
Oh, that's awesome. Good.
That's the first time we heard that. That's great.
That's great.
Yeah.
Awesome.
Well, thank you so much. I mean, it's so, just hearing your talk, it is able to cross disciplines and energize people like me who do adult plastic surgery, don't even go to the head and neck for the most part. But just hearing your interactions with parents, how much you have to take the whole picture into consideration, the social bullying, surgery versus not surgery, all of these topics, and you just deliver it so beautifully. So thank you so much. And I hope that the rest of your time in Philadelphia is good.
Thank you.
It will be. Thanks very much for
Thank you. Thank you for listening to The Deep End, a plastic surgery podcast. If you've enjoyed today's conversation, please like, subscribe, and leave a rating on Apple Music or Spotify. Video from the podcast is available on Instagram and YouTube at The Deep End Podcast. Join us again soon for more conversations with luminaries and experts in the world of surgery.